That's okay. So again, it's not just answering the question, it's like having the data to support it. And is your organizational structure and staffing appropriate for the continued operation of your site? What is the level of collaboration with your internal and external partners? Is your budget sufficient to cover costs in the future? To what extent are different program components sharing expenses? And to what extent are your marketing and public relations effective in publicizing your site? Who is receiving information about you? What communication vehicles have been most successful? And I love this because it makes me think like, so again, I'm going to use Doris in New York. So you have this plan, but you're going to want to go back through the years and just check to make sure that it's still, all the components are viable, that it still makes sense with all the changes. And so this is a nice little checklist. And if you go to the website too, you'll also see wonderful resources to answer some of these questions. So they're very strong on the marketing piece. I'm trying to think what other piece they were. Evaluation and marketing and funding. They have more resources for all of those. So if those are areas that you want to strengthen in your program, that's a good way to do it. Okay, I'll send that link out. And as I work on the standards and measures, I'm going to start referencing that in that report. So we'll come back to this over time. And with that, we're going to just go around and do brief report-ins. And Doris, I'm going to call on you to go first because most of our group is new today. I mean, Tracy's a long time or two. Yep. But so Doris, maybe we'll go with you and then Tracy so people can kind of know how we do this.
Sure. Okay. Just glad I'm not presenting today because I got your email and I went, oh my God, I thought Dina took care of that. So I'll share all our sustainability stuff next month, but you know what I think of most when you went through that whole thing with Generations United, which I get all their emails, I follow them. They are an amazing organization. Yeah. It's the constant really rechecking every year check-in, especially during COVID. You know, the landscape changed so much that it was really helpful. So we've been through the toolkit. We completed the toolkit. And next month, I'll share our final documents with you. But we have so much going on right now. I don't even know where to start. So Jill, I think I had told you about the AmeriCorps opportunity. We've been working with them. It's non-competitive, and they have invited us to submit the full application. It feels like a formality because they're like, we want this grant to start August 15th.
Oh, that's so amazing, Doris, really.
That is an amazing project, and we're taking on 11 counties right down the middle of the state. This is our first foray into AmeriCorps, so we will be recruiting senior companions. But the out-of-the-box idea that we presented that they really liked was that we go into these counties and we do a community scan and we figure out what are the organizations that are doing respite, wanting to do respite, are using volunteers for respite, and partner with them to recruit these volunteers so that we have many, many respite opportunities throughout that region to be able to connect volunteers to. So it's not just one choice, but it might be 20 choices by the time we're done. So that's the really exciting piece. We have incorporated, even more exciting, we've incorporated the Wisconsin project into it. So all our respite volunteers will be trained through the respite and put into the respite registry. Unless we are doing in person, because we've committed to try and open 10 faith-based drop-ins. I think I dropped it to 7 because it's a long story. Anyway, we're going to try and work with faith communities to open respite programs, staff them with AmeriCorps volunteers or other community volunteers, and use the Wisconsin training to be able to do that. AmeriCorps is really excited about pathway to employment for older adults. So that's what really hooked them. And we're really excited to be doing that. So we've contracted with Gnosis to get our registry up and running in New York.
And so let me talk a little bit just to make explicit to the group about, you know, what this has to do with sustainability. So I mentioned before, money, diversified funding, and strong partnerships. And I don't know if this is true, but I think the way New York went about planning, so thoughtful, so inclusive, not hurried, facilitated by a really strong leader, and and New York has a strong leadership team. As do the other states that are all on this call. All those things strengthen sustainability. So it's not just having the plan. It's like the plan is kind of takes on a life of its own and creates other opportunities.
So then we've been invited to put in a full application to the Exhale. I think you're familiar with the Exhale. I think they're presenting somewhere soon. Oh, they're presenting in Wisconsin, right? So they did a new round. So we've partnered with St. John Fisher College here and a neighborhood center, and we'll be opening a drop-in respite center. But the key piece here is that we're working with the college to develop a toolkit so that respite program, community-based, student-led volunteer programs can be replicated across the state and the country.
Oh,
So
that's
that's
great.
really exciting. This is all happening within a week or so, that all these options are coming in, right? And then one of our biggest hopes that came out of the last sustainability retreat was the legislative advocacy piece, which is where we are really weak in, as far as I'm concerned. And then we were invited into the Grant Makers and Aging, changing the conversation. So I've recruited a few new people to kind of work on that and lift it up. So we have a lot happening on all fronts. And
you got some good partners to go to in this group for the legislation and advocacy.
Yeah, I know we do. Yeah.
So yeah. And
so that's probably enough for me.
That's really great. And again, those of you who are new to the meeting, you may not know as much about your state, or everybody's from a strong state in this group right now, but don't feel like you have to match Doris's. New
I've been
York's
at it a while.
Yeah, she's been at it a while. New York's on fire right now. And I don't know, Doris, if you've noticed this, but like just to see the growth in this group, like how deep and connected each state's work gets over time is really exciting.
Well, and I'm going to say on top of that, so we're also going for a paid membership campaign. This is our first.
Oh, this is new.
And we're modeling after the Florida Respite Coalition. So
Okay.
there is a lot of crossover. And I'll just tell you guys, if you're new, come to the Wisconsin conference. There's a ton of networking to be done, and you will make connections like you've never. This is the place to do it. So
yeah.
Be there or be square, right, Jake?
Okay.
I'd like to hear more about at some point how you're modeling it after the Florida Respite Coalition, because they really don't even exist anymore.
They don't? I've been on their website.
Yeah, but nobody's even monitoring it as far as I know.
Well, I love their website, and I love the fact. Here's what I love about them. Because membership is a really vague thing for everybody, right? Some coalitions do membership by how many people they send out their newsletter to. Some people partner with businesses and other organizations. But since we're so heading deep into the working caregivers and businesses, they have on their website, just to be a member, you just have to sign a statement that you are you agree with the mission and the vision of the organization, and you support them. And for a really small fee, you'll be able to put your logo on our website, which is what we're trying to do in networking with businesses, because the other one is the Massachusetts Business Coalition, right? And they are amazing in what they've done working with businesses. Yeah. And so those are the people that I look to. And I didn't realize Florida wasn't, but their website is great. So there you go. We're redoing our website.
Okay. Well, you just keep us posted how it goes. It sounds like a great idea.
For the next month. Yeah.
Okay. Tracy, you want to hop in and let us know what's going on in your neck of the woods?
Yeah, I think the most exciting thing since the last time we talked, Cheryl and I spent a lot of time in Montgomery, which is our state capital, during the legislative session. And, we do a lot of educating our legislators about what respite is, the need for respite, and how state dollars help us bring in more federal dollars. So we already receive a state appropriation as match to our federal lifespan respite grants. But when we applied last year for the enhancement grant, we had to leave some money on the table. We weren't able to apply for the full amount because we didn't have enough match. So we went back and said, look how much money we left on the table. Look what that would have translated into as far as respite hours and services for our caregivers across Alabama. And so we were able to come back, and we increased our annual appropriation from the state from $175,000 annually to $315,000 annually. So
Holy
we got
cow.
$140,000 increase. And so
Oh, that's great.
yeah, we're very excited about that. And our coalition, you spoke about coalitions, how they're all different. Ours is state appointed by the governor. And so we have representatives from, Department of Mental Health and Medicaid and DHR and, all these different services. So they helped us with this process too. It wasn't just Cheryl and me by any means. They all were educating and talking to our legislators as well during this process. So we're very excited to have gotten that increase. And so with that said, once we got that secured, then we went back to ACL and said, we have now secured this funding. And so we have put in a request to see if we can recoup what we left on the table. And, that's a possibility. So fingers crossed that maybe we can get that for the remaining 4 years of that grant, go back and recoup that. We don't know for sure if that'll happen, but they said, they said ask. So we did.
That's great.
Yeah.
And you will put it to good use there.
Yeah. And Lori, we were working with Lori Stahlbaum with that. So we are fingers crossed that maybe that'll happen too.
That's a wonderful report.
Yeah. So other than that, we also contract with 13 of our AAA programs that, across the state, and to administer their personal choice option respite reimbursement programs. And so that's a big revenue source for us. And we just recently started talking with another state partner who is very interested in us doing the same thing for them. So possibly we'll be doing that soon for the Individual and Family Support Council here in Alabama. So those, along with Department of Mental Health funds, are all things that, we do on a daily basis to help with sustainability. And then what was the other thing? Oh, we awarded 3 respite grants recently to start up an expansion of community respite programs. So 3 programs statewide, and they're kind of all over the North, Middle, and South. 2 were new programs, and 1 was for expansion of an existing program. So we were very happy to be able to do that as well. And it seemed like there was something else I was going to tell you. Oh yeah, you're talking about data. That's what it was. We recently compiled all of our caregiver satisfaction survey results and shared those with our state partners. And we had, the numbers are always great, but where we have the chance for additional comments for caregivers to write in how respite, specifically respite, reimbursement is helping them. We just had some amazing feedback there. And so that was powerful, great to be able to share with our state partners too.
That's wonderful. So just going back to that one generation checklist, or just the questions, you see the diversity of funding, you see the strong partnerships with the community programs, with the state agencies. And I'm wondering about that, the governor appointments. Does that give you kind of more clout with the state agencies, do you think? Like, is there a bigger investment in respite because of the way that process is structured?
I think so. I really do. It's so interesting to me, they really get invested. Like, I really feel like I'm the staffing entity to the coalition, but I really feel like they're very invested and they know who to turn to when they're working with caregivers or caregiver issues come up, and they know it's Alabama Respite, that they
Right.
need to
Right.
contact. And like I said, we have good turnout at our meetings. We have a lot of investment as far as them sharing resources and, like I
Mhm.
said, going and advocating for us and educating.
Right.
So I do
And your
feel
state is so strong on the advocacy and education. And it's like, you have this long history of this, but it's interesting to think about how all these pieces fit together. And when you strengthen one piece, it kind of strengthens other pieces. Like, how can you advocate if you don't have the strong data, which you always do? So just thinking about your state. Jill, you may have this history too. So how did that come about that the governor appointed the agencies to respite? Was that?
That was a very strategic
Okay,
decision
that's what I was
on
wondering.
the part of Alabama Lifespan Respite. And it wasn't just establishing the coalition this way so that they knew it would be there forever if you put it in statute. But they also had a resolution enacted that recognized, tell me if I'm wrong, Tracy,
Yep.
that recognizes Alabama Lifespan Respite as the entity in the state for
Correct.
lifespan respite.
Yes, correct.
That was done at a similar time.
It just makes me think back to when we were looking at the first finance toolkit projects for sustainability. The work of the project itself could be really strong, but if that state infrastructure was, if the state partners weren't invested and committed, you just barely have a chance.
Well, the early models of lifespan respite, the Oklahoma model, the Nebraska model, the Oregon model, the Wisconsin model, they were all based primarily on the statewide coordinated system. And that meant you had to have strong partnerships between states to make the definition of lifespan respite, which is a statewide coordinated system of respite services, to be meaningful. When we got the federal money, we didn't get enough money to
do
be
that.
able to do that for every state in a meaningful way. So it's morphed and changed to what states were able to accomplish. But Alabama did this way before the federal law.
Right.
And
if your state's like that and you're one of you women, your life is easier. I mean, a lot of the sustainability is just much more likely to happen because of that, the way it's designed.
Could you share a copy of that original legislation that got you there?
Sure.
It's on the Arch website too.
Yeah.
We have a page on state respite legislation under tools. I'll put that link in the chat.
Oh, thank you. And Tracy, how often does it turn over that you have new people?
Every 3 years.
Every 3 years.
Yeah, the governor makes appointments every 3 years, unless, of course, some of those are elected, so it may run against an election cycle. So if someone's not reelected to a position, it's the position, it's not the person that the governor appoints. So, for instance, if it's the House Ways and Means Committee chair, then whoever is the House Ways and Means Committee chair will be appointed. The governor just changes out those individuals.
Right. And it's kind of in their job description, right?
Correct.
Just there.
Yeah.
But what's so cool about that, one of the things I think is, so when they come on, when there's staff turnover, there's still this other group that's really strong. So it's not, I think it's just a real uphill battle for states where you have one committed partner and you're really relying on them, and then the governor changes and that partner changes and you're starting from scratch. And so that doesn't happen with you. Oklahoma's got really strong, and let's hear from Oklahoma too. So we have Stephanie, who we know, and Talina, who we're just meeting, and you're in the position, both of you, or Stephanie's been there a little bit longer, but Talina, you're new. So just, you can say anything like, I don't know anything yet, or just.
So I think the news that has happened with us is me. So that's about all I have. me questions or, and I'll try to fumble through it. You know, I'm not new to respite or respite services. I have a background in that, but still learning the pieces and how they all fit together. So
We have great colleagues. Yeah, we know that. And you're from a really strong state and strong program. So tell us about your background in respite. And
so I previous to this position, I had a Title III. I ran a Title III program for respite. And I've worked with supportive services programs for about 20 years. So respite's always been something that is, you know, should be at the forefront of those services. And I ran a grandparents raising grandchildren program as well. So
oh, nice, nice. And so now you're in the hot seat in Oklahoma.
No, and I don't mind at all. I just, like I said, you know, trying to figure out what I see Jill everywhere, and I'm like, what are we doing today?
Yeah, well, you have lots of support from this group, and you know, Nadine's wonderful, and
Yes.
so we're really glad that you joined.
Well, thank you. Stephanie may have more to add. I'm sure she does.
Yeah. Hi, Stephanie.
Hi. We're just doing awesome things in Oklahoma. I help families when they receive their respite vouchers. So they contact me to get their application and their vouchers. That's kind of my role. So I just know that we're seeing an uptick in families, especially with summer coming, families looking for, you know, those respite vouchers to help pay for care during the summer.
Right.
And we're just happy to be able to help them and help connect them to programs to serve them during the summer months when their children may be out of school.
Yeah. Yeah. So I'm trying to remember how long have you been with Oklahoma, like how many months, or has it been longer? And
I started with the respite program in March of 21. So
okay.
it's been a little over a year.
Okay. So you've been through the last part of COVID.
Yes.
And your coalition meets, I think, online, right? Is that correct?
Yes. We meet quarterly on.
Yeah. So how's all that been, all the coordination gone like the last year with all the changes, and how have you kind of weathered demand changes or model changes
I know
during
for
that past? Oh, go ahead.
For me, I like the online meetings because I live an hour and a half from Oklahoma City, which is where they held the meetings previously. So for me, it's been more convenient to be able to just get online. And I think I'd never attended the in-person meetings. So when I came to this position, they were already online. But attendance seems to still be good. Talina may have the numbers of what it was previously and what it is currently, but I think it's still very active.
I had previously attended as a partner, and it was difficult. The in-person was difficult, but it was nice. I mean, they provide lunch, me now, but they then. And it was good to really have those deeper connections and really know that you could congregate afterwards and really just get to know more about the services versus it online. I mean, I think what we struggle with in any presentation is that it doesn't, nobody's going to walk right up to me and say, man, that was good. Can you tell me more? You know, and it's not a lot of people are going to pick up that phone or that email unless it's just something that's dire. It just feels like maybe another task. So I love the in-person because of that aspect of it. But I think with the online, we have the ability to go statewide, you know, to really reach statewide community partners. And we got an email this morning, and I don't even know if Stephanie knows this, but our Awala group is being required as their field trip to attend our next meeting. So, you know, and that got my wheels rolling. I have a daughter that's currently attending CNA class, and I sent her with some respite flyers to class. And the teacher was just like, how do I sign up every one of these to provide respite? And I was like, that's a great idea. I've got a registry coming. Give me a minute.
Oh, that's great.
But in addition to that, you know, why could they not be a part of the coalition? And why could that just not be part of the curriculum? And, you know, we've got several avenues. So I'm really excited about some of the things that have come from that and the ability, but to have it so easy to attend. You know, maybe a hybrid
Yeah.
option would probably be what I would prefer, but
Yeah.
either way.
Yeah, but it's interesting because you have one of the stronger coalitions, I think, because I mean, it's really broad, but the way that people are engaged, like Nadine used to describe the lunch and learns and like calling on people for expertise. And I just wondered if that, you know, how you've kept those strong partnerships going during the year. And that was a good example.
I think this position and Stephanie and Nadine's position, they know when they come, what I've noticed, and even in my previous position, if I had an issue that came up that was respite related and I needed an answer, I called the person that was me. I called Nadine and I called
Right.
who, you know, those coalition leads that are always there, you know, they're the constant.
Right.
So, you know, as long as
Yeah.
we continue to bridge that, we'll be fine.
Yeah. Yeah. Good. That's an impressive report for not being there very long. So
Well,
we're
thank
glad to
you.
get. And then we have Melissa, and I think you're pretty new, or I haven't met you anyway.
I am new,
From
but
South Carolina.
Nicholas has also joined, I see.
Oh,
So
Nicholas,
he
welcome back.
he will have more information. But yeah, I am almost to 2 months in my role. So new, but excited to be here.
Yeah. And did you have a background in respite when you came, or is this all new to you?
I have a background in nonprofit, so
Okay,
not
good.
specifically respite.
Uh-huh.
And so it's been nice to learn some of these specifics. I did deal with some demographic crossover in previous work, but it's been exciting to learn this more in depth.
Yeah. Yeah. Well, welcome to the respite community.
Thank
It's
you.
the nicest. It's the nicest of all the helping, the helping services, I think. So what's going on in South Carolina? Nicholas, feel free to jump in too.
Yeah, sure. So yeah, I guess in full disclosure, we have not been in sustainability mode. We've been in survival mode.
Yeah. You and a lot of people.
Yes. I've been only man on the ship for the last 7 months until Melissa was able to come on. So it's been interesting just trying to keep all of the gears greased.
Right.
Not really a whole lot of new development and able to really work on a whole lot of stuff outside of just being able to kind of keep the lights on what we had kind of moving. We are working on a legislative education packet instead of doing an awareness day this year. We're putting together a nice booklet that's got some national stats, a lot of local stuff, letters of support, faces of respite, that kind of stuff, letter addressing some of the gaps in services for our state. And I'm going to be distributing those more than likely in person, and then trying to get some follow-up time to get some one-on-one with either aides or some of the elected officials that I have some previous relationships with to just do some follow-up there.
That's
So
great.
that's kind of our probably our most interesting thing at the moment, outside of, you know, all the hopes and dreams that we've been writing down and hoping to include in our next grant cycle. So
Right. Well, you know, South Carolina has always been really a strong respite state. So the survival thing, I mean, we just see states go through that. That's part of sustainability, right? You're not always firing on all cylinders. So what has been helpful? I mean, you've always been strong on data and you're doing the legislative piece. So it sounds like you're not just laying back during this during the survival time. There is some forward motion, even though it sounds like you've been doing it by yourself.
Yeah, it's one of those things where it goes back to that old metaphor of kind of growing where your blossoming where your seed falls.
Right.
So we've been trying to just do the best that we can with kind of what we had. So we have done some things like we modified and updated our break room how-to guide and distributed that out. We
that's great.
did an update to our What You Need to Know About Me book, which seems to be getting pretty well received. And then we're pushing that on Facebook through some ads. So we're trying to do some outreach with that there. So just trying to do things where we do a little bit in the front, and then on the back end, there's a lot of other people that are supporting it or pushing it or sharing it, that kind of thing. So, and then that way we can kind of get back to the behind the scenes stuff,
Right.
which seems to be helping a lot.
Yeah, good. So how are partnerships going there? Like, do you feel like during the pandemic, the dynamics have changed in terms of coalition members, state partnerships?
Definitely. And I don't know if it's a result of being put into like a Zoom cubicle or silo,
Right.
or if it's just the nature of the beast with everybody just having to really kind of do inward focus.
Right.
Especially with other nonprofits, as donations have dropped and funding has dropped, and everybody's just kind of really focusing inwards to their own organizations and not really interested in partnering and getting into more stuff that they really don't have the resources to support themselves. I think that's kind of impacted a lot of the partnerships. Not that they don't love us or love the mission. It's just, it's tough with the resources that everybody has.
Yeah. And
And
if everybody's oh, go ahead.
No, and from my perspective on getting to meet some of these partnerships, I think that's exciting because that gives us another touch point and a reason to talk. But then also it's been nice for me to hear, like, even if there hasn't been a 100% active thing going on between us yet, they all have such positive things to say about the South Carolina Respite Coalition. And so that gives me hope that we can use that and use some of this new stuff to keep the movement forward.
Yeah, you have you have a very good reputation. So yeah, that goes a long way, doesn't it? So you just need some more warm bodies as team members make a difference. Yeah.
Have you all been able to maintain that fantastic line item you have in your state budget for respite, or is that waning too?
For the vouchers?
Yes, yeah.
Yeah, that
Isn't that a couple of $1 billion or something? I mean, not all for lifespan, but a lot of it's Alzheimer's, but I know you've managed to get a significant chunk for other populations as well. And is that still in the state budget?
it is not. That I'm gonna say it got stolen from us, because it's there, it just didn't come in our direction. And that was about $200,000 a year. So we very quickly went from $250,000-$60,000 a year for direct service vouchers to this current year, we're at $62,000 for direct service vouchers.
Oh, that's a big
Wow,
hit.
that's so sad.
Yeah, but that's part of
What's
so
happening?
because we're dealing with Department on Aging and all that kind of stuff,
Right.
that's part of what I'm hoping is going to come from legislative packets, is being able to kind of have some influence to get that redirected back towards us and or find other options.
Yeah, that, I think it also points directly, we've talked about this so much, changing people.
Yes.
You had such strong advocates in aging there until one person retired.
Yes.
I'm sure
Now they're
that-
focused in other areas.
Yeah.
Yeah. We've seen this. Yeah, we've seen this with other states. It's a hard spot to be in, though. I love the break. I mean, just like the silver lining, I love the break rooms that you're doing. I mean, that they're strong in and of themselves and something that you can brag about for sure in terms of advocacy. But, oh, that's a big hit. I'm sorry to hear that. Okay,
Yeah,
well,
it is. So it's hopefully, and also too, it's bad timing just because it's an election
Yep.
year. So hopefully once all of that nonsense kind of settles down, then we can, kind of focus a little bit more on some of that policy stuff and state budget.
yeah. I'm thinking Maryland was another state that when they had state leadership changes, they kind of had to it was a sort of a do-over for them. So you might like talking, well, Yetunde's here today, and I think you're pretty new, Yetunde, so, but I'm thinking of Leanne Winchester and Amy Nazaire. You might like just to have a conversation with them, just because they had to kind of regroup at one point and get things going again, just if you want like moral support for that process. It's been done before. It's a hard job, but it's been done before. And I have absolute faith that it's all going to go in the right direction for South Carolina. You're strong there. So, but I'm really sorry to hear that.
Yeah, I appreciate it. If not, I mean, I still am an Italian from New York. I still have my Louisville bat in the closet. I mean, if I have to break it out,
Good.
I'm not that rusty yet.
No, good. That's great to hear. So, Yetunde, do you feel like you have been there long enough in Maryland to talk about anything new there? Do you want to just say hello to us? And
Yes, I've only been in for 6 weeks.
okay, you're really new.
Yes. Well, I am not new to respite. So I'm not sure if you guys do know that the respite program used to be managed by an outside company called Eastern Seal prior to 2018. So in 2018, they decided, no, we just want to have each local Department of Social Services to manage their own respite program. So I was introduced to respite at that time in my county, Baltimore County. And it was just like, hey, Yetunde, you're going to be good with this. There wasn't any instruction. There wasn't any guideline, nothing. So I had to do a lot of Google research just to try to see what is it that I'm supposed to do. So I did that. And I think I'm coming. The first person that talked to us, Doris, we have Naomi. Naomi used to be in this position. She recently moved to Alabama. So she's there. She's only been there for like a month. And I have been doing respite in Maryland, and it's very big. I am in charge of 24 local Department of Social Services respite program. And right now I am so busy because we're coming to the end of our fiscal year on June 30th. So I'm in charge of trying to make sure one local is spending their allocation, and I'm taking money from another local, giving it to another one. It's just been so busy. And like I said, it's only been 6 weeks in here, but I feel like it's been 5 years already.
So it's going to be a steep learning curve. Something that you said when you first started speaking about like having to Google to find out what the job was. And one of the things we've stressed in this group is creating a historical record. So when somebody leaves, whether it's a planned leave for retirement or an illness or death or whatever, the next person that comes along has this historical record and actually people to talk to. So that's something we really urge, that if you're in a leadership position in your state, that you start assembling documents and you have a plan to hand them off. Succession planning, we call it, because we have seen states that were once strong really falter when there wasn't a good handoff. So you bring up something that's really, really important.
And
So-
I'm gonna be attending the upcoming conference.
Oh,
Fingers,
good.
fingers crossed. I am working with Jill because when I first received the email on Monday, I'm like, what is this? What is she talking about? Because no one ever said anything to me, but it's been back and forth email to Jill. Like, do you think my job is gonna pay for me to go? And how many days am I gonna be in here? And she's been very, very supportive,
Yeah.
responding to my emails. And Jill,
Yeah.
I don't want you to think, why is she always emailing me? I'm sorry.
I know that's why we're here, to totally support you, and we really want you to come to the conference.
Okay.
Absolutely.
So is there anything we can do that you can think of right now in terms of support? You've made some new friends today.
Yes, I mean, I have everybody's names down, so I'm sure I can email people to ask questions.
You sure can, and don't hesitate.
Okay, thank you.
I just wanted to clarify, Tunde, when you were talking about managing all these dollars for respite, you're talking about the big state-funded respite program, not your
Yes.
lifespan. Yeah, Maryland has a very long-standing adult respite program that the state has funded for decades. Very generously funded respite program through adult services in Maryland.
Yes.
So, and is that money, it doesn't go away? It's like as reliable as
pretty stable.
It
as
doesn't
things
go
can be
away.
stable
It
funding.
gets shared between 24 other local Department of Social Services.
Okay.
It's a little over $1 million every year.
That's a nice little chunk. That's great. Well, we're a little bit before the hours. Does anybody have any parting words of sage advice, support for one another?
I have a quick question for Doris Green. Can you please explain or talk more about the drop-in respite center?
Sure. So we have a county in upstate New York, it's called Erie County, and their Department of New York State Department, their county office for aging, started a program years ago where they would give a faith community $1,000 if they wanted to start a drop-in respite program. Now, these are all for early stage memory impairment, pretty much. So, but we've done a lot of mini grants throughout the years. We put out money every year for new program expansion, new programs or expansion to increase respite in the state. And so we've had churches that have come on board to do that. We fund them a little more generously than the $1,000, but Erie County has some almost 30 programs where folks, and they're all volunteer based, right? So they can drop off their loved one once a week, twice a week, whatever it is. There's just so many programs that there's options all over and around the city of Buffalo. So we've started a few here in Rochester, and we hope to do under the new grant, fingers crossed, that we'll be able to do that in central New York. We're also trying to do one in up in the North Country, which to you guys is like the Adirondack Mountains. And we have a lifespan respite enhancement grant where we started a caregiver wellness and respite resource center up there that focuses on 5 very rural counties. And we've been through our planning year. We're about to kick that off in June. So it's really exciting that that's going to be going on too. But if you want to talk about those, some of them are school-based. Colleges and universities can do it. Faith communities can do it. CBOs can do it, right? It's not just, but it started really strongly in faith communities in Buffalo.
Yeah. And I love these, I love these models and the community commitment. And South Carolina is another one with the break rooms that I think are a really strong model for getting community awareness and involvement going.
Yeah, I love that name too. I think we should think about stealing it. But you've had enough stolen from you, Nicholas, so I Tracy.
I wanted to say sorry, did I interrupt you?
Oh, go ahead.
Tracy, I saw your video on, was it the World Carers conference call? You did such a good job. I really
thank
enjoyed
you.
it. I've had a couple conversations here since listening to it. So thank you for doing that. You did such a good job.
Well, thank you. I'm going to be presenting at the arts conference about mental health. It'll be different than what I talked about with, I kind of just did a quick overview with Mac, but yeah, we'll be talking about it again at the arts respite conference.
Nice.
So Tracy welcomed me to Alabama when they did this amazing thing called a caregiver simulation. And I went down to Alabama and witnessed it. And then we've been able to replicate it in New York, and we are doing one in August. I'm very excited that we're going to be back at it because COVID just killed us for caregiver simulations. Are you going to be able to do any?
So actually we have gone to, we have a virtual kind of thing we do now, and we actually gave our kit for the in-person ones to our local college, and they're conducting them.
Oh, cool.
So, yeah,
Oh,
their social work programs going around and conducting them. So,
Cool. We just put together a manual. We're about to put it to print so that any organization can pull it off. So
awesome.
and we're modifying this one to reflect working caregivers problems. So we're really excited.
Yeah, that's awesome.
Cool.
I love this cross-fertilization. We all are wonderful and amazing. Okay, Nicholas had to leave a little bit early. Okay, I want to thank everybody for coming before the Memorial Day weekend. First of all, joining the meeting, and just for your work during these like really challenging times that you all have kept going, and like the wellness initiative and the caregiver simulation training and the involvement with the colleges and universities. It's just like, it's a really heartening and a really disheartening time. It's really respite, just kind of, you all keep going and doing good work, and it's pretty wonderful. So thank you all for that.
I love your new haircut, Jill.
Oh,
I know
thank
it's
you.
cute.
Just cut it all off is my new motto.
That's my motto.
I wanted to say for all of you wonderful new people, and I want to echo everything Susan said. I'm just always amazed to hear what you've all been able to do with these tiny little lifespan grants and your growing partnerships in the state. But Melissa, Talina, Utenda, if you have anything you want to sit down and chat with me about, just background on lifespan, or you want to just know about Arch resources on the website, because I know it's a really right now very hard website to navigate. I am very happy to meet one-on-one with you, or however you want to reach out to me. I'm really happy to help you. So just let me know.
Thank you.
Yeah. And all the learning collaboratives are just to meet other people. And, this one's smaller and more interactive, but you can sit back and listen to the other ones. Don't, just take in as much as you can. There are lots of good people to help you. And we're so glad you're here.
Yeah.
Thank you.
Thank you.
And everyone have a good weekend. Do not miss next month's meeting, because New York did a plan, and that is a really big deal. And we're going to hear from them.
Now we got to do a
June.
presentation. We'll figure it out.
Yeah, it's a big deal. Okay, everyone. Thanks so
Thank
much.
you.
All have a
Have
good
a
holiday.
good, safe, wonderful weekend.
Thank you guys. Bye.
Bye.